If you would have asked me in second grade what I was going to do, I would have answered, I'm going to be a doctor. My desire to help people, I think, just comes from example. My dad is a physician here in town, my mother is an RN, and so I grew up around medicine. Both of them have always led by example, taken care of patients and always treated everyone equally. My work is rewarding because I tend to get patients back to a level that they haven't been at for a few years. So they're able to return to work without having their hip or knee pain, or they're able to take care of their family, their grandkids, and no longer have to worry about hip or knee pain. It's very rewarding to see the fast turnaround of a minimally invasive hip or a minimally invasive knee replacement. I love when patients tell me that they were back at work in 2 weeks. I love when they come in to see me at the 6-week visit, and when they walk in, you can't tell they had surgery. When I see a patient in the office, I think it's very important to educate them on not only the surgery, but what their diagnosis is. It's completely normal to have worry, have hesitation, and the best way to get through that is to educate them so they understand what's coming, and that seems to really bring that anxiety level down. By getting rid of that medical jargon and just speaking one-on-one, just like I want to hear when I'm speaking to my accountant or to somebody even at the mechanic shop, just tell me what the problem is and how we fix it without any confusing terminology. I find the patients really relate to that well. They feel like when they leave, they can explain their diagnosis and their treatment to their neighbor, and that's really my goal. The quality of life I wish for my patients is that we have a goal of what we call the forgotten joint. But ideally, by the time you're a few months out, you just get up and go, and if someone says, "Did you have your hip or knee replaced?" you really have to think about it or look down and say, "Oh yes, it was my right knee or my right hip." So that's our goal, is the forgotten joint. My name is Bhargava. I'm an orthopedic surgeon specializing in hip and knee replacement. I currently work at Mid-America Orthopedics. Well, I specialize in minimally invasive anterior hips. We do that here at Kansas Spine and Specialty Hospital.